time to meet with us today will be starting momentarily. So Chuck Gus will be kicking us off. He is the Senior Director of Business Development and Employee Communications at MediaTile. Chuck, whenever you're ready.
Yes, hello everyone. Thanks again for joining. We know that everybody has very, very busy schedules, and hopefully this becomes a great learning opportunity for you. Very happy to welcome Mike Lee on the call with us today. He's the Director of Communications and Marketing for Dominican Hospital. I'm going to be kicking off this session and then passing over to Mike a little bit later. But again, thanks again for joining and taking the time. And this is in a series of webinars that we've done throughout various topics as it relates, and we've always had our customers join us in to kind of help flush out the conversation and provide their unique perspective. So we'll start advancing here through the webinar. So for those that aren't familiar about MediaTile, here's a quick slide. We won't spend a lot of time talking about us. We want to focus more on Mike Lee and Dominican Hospital. But just to kind of level set for everybody, our approach to digital signage is very cloud-based, using 3G and 4G cell and a SaaS-based content management system. For those that aren't familiar, SaaS is software as a service. Basically, customers we have across various markets using this to communicate with their audiences, oftentimes in many ways that they never were able to before. It takes place of other communication that maybe had a lot of cost or complexity to it, and gives them a unique way to communicate to their audiences. All through maximizing viewer engagement, we make the solution very simple to deploy and easy to use. And this is what Mike Lee will be talking about here in a few minutes. So for those that aren't familiar, what is digital signage? Well, basically what we see out in the world every day today. These are intelligent displays that you, the communication, the marketer, the IT pro, you're communicating your messages to them. Very targeted, very relevant to those audiences. And when I talk to a lot of our customers and prospects, it's all about delivering the right message to the right people at the right time. You see a stat there alone, 155 million adults each month are reached by out-of-home. That's what OOH is, out-of-home video displays. Again, I've mentioned some of the various markets that we're in. Obviously, today we're here talking about healthcare, but employee comms, banking, government, hospitality, brands. I mean, as we travel, we see digital signage now everywhere, almost to the point at times we don't notice it as digital signage, but just as some kind of digital communication board that's visible to you. So a big part of what MediaTile, how we engage with our customers, we've all heard the term B2B, and then we've heard the term B2C, B2B, business to business, B2C, business to customer. But we take it more as a B2Me. And the design behind that is making that communication relevant and engaging. Again, right message to the right people at the right time, B2Me. You want this to be highly engaging and highly interactive through our personal advantage and cloud-based solution. Again, it's all about getting those right messages to the right people. B2Me is the approach to do that. That's a constant challenge that communicators and marketers have. How do you deliver that message to that person? Digital signage lets you make that content more relevant because you know who those viewers are. So the market drivers behind digital signage, there's 5 main drivers behind it. One is control. So you've got a centralized management system that lets you put those messages out there and hit your right audiences. 2, placement, which is more and more research and studies are being done around the best places to put digital signage. People view them as networks of weight, networks of transit, networks of purchase. Putting displays where people are going to notice them. It used to be the case people put them up too high or they put them too low. Placement is going to be key. 3, video and content ultimately will determine the success of a digital signage network. Sure, the hardware is great. Having great LCDs is important, But at the end of the day, content is going to be what will determine the success. If it's relevant to the audience, the network will be successful. And that leads us then into engagement. How are people engaging with the screens? Is it purely from a viewer standpoint? Is it touchscreen where they can interact? Those are some things to consider when you're launching your network. And also metrics. How are you measuring the success of that network? All of these things will determine the success of a digital signage network. So I mentioned cloud-based advantage, and what does that mean? For one, it's our SaaS-based platform, which is MediaCast. Entirely controlled through your web browser. There's no software to load on a PC or a Mac or wherever you are. As long as you've got a browser and connected to the internet, you can manage your network. Simple to deploy. Mike Lee is going to be talking about their cellular digital signage approach through 3G Cell. Basically means there's no on-site networking. You can put this display anywhere you want. As long as it has power running to it, you now have a means to communicate to your audiences about any impact in your network, whether that's because of security concerns, a network is locked down. Cellular gives you that advantage of riding your network on the very now powerful cell networks that are out there to get your messages delivered. And through these, there's a big cost reduction that takes place, less impact on infrastructure, and the complexities are reduced tremendously. I mean, my background was spent in manufacturing communication, and some of the complexities involved in working through various IT networks can sometimes almost kill an idea or kill a project. But through cellular digital signage, you can still install your network without having that same impact. So this is a slide I wanted to put up, and this is something I've been thinking about more and more. And a lot of these words that were on the slide. Can we jump back one?
Sorry.
That's okay. Here we are. One more. There we are. So these words, attract, educate, overcome resistance, establish credibility, tell a story, build buzz, build fans, inspire. These are all words now that people are using in social media. Those are words that people want to use to engage audiences, get feedback. These are the exact same words you want to use when you're talking about a digital signage network. Obviously attract. You want to get people's eyeballs. We're naturally drawn to TV screens. Educate. And part of that is overcoming resistance of communicating new information to them that maybe they reacted differently to before. Building credibility. Telling stories, honestly, is the best way to get anybody to remember anything. I just read a great study about that, about the impact of telling stories. And digital signage gives people the ability to do that, that maybe they didn't have before. And inspiring. When we talk about healthcare, those stories exist every day, everywhere. And digital signage gives companies and healthcare organizations a platform to help share those messages. So, as I mentioned, my background was spent largely in manufacturing, which has its own unique challenges. But since I've started working with MediaTile, I've been here now for a little over 4 years. I've learned a lot from the communicators and marketers in healthcare and some of the unique challenges that exist in hospitals and medical office buildings. Some of these other environments we're talking about, waiting rooms, admin areas, employee lounges. A lot of private companies, you just have your employees and that's it. As those of you who work in healthcare organizations that are on the webinar today, I've never looked at audiences the way that I know that healthcare marketers have to. The fact that one of our hospital clients shared with me in a very obvious statement, but just something I hadn't realized, that their employees, who you communicate one way to, are also their customers, who might be a patient at the hospital, might be seeing their doctor at the hospital, but you communicate to customers in another way. So it does get to be a challenge sometimes in health organizations on this communication when the same people could be filling multiple roles within those audience segments. And then two, the importance of brand messaging. How are you communicating the brand internally to your employees, to the staff, and then how's that brand extended out externally? Another one of our healthcare customers recently redid an internal or a new branding campaign and started internally, which is actually the opposite of what a lot of companies do, but it actually makes a lot of sense. They did their internal brand first, so they got employees believing in the story, hearing the message, understanding what their new brand was. So when they went external, employees were their storytellers. They were the ambassadors. So digital signage gives you that ability to start segmenting your messaging a bit, but understanding that that challenge, I think, is a bit unique when it comes to healthcare organizations. So we talked about those different audiences that are out there for, we're just looking at in hospitals and other healthcare facilities. You've got doctors, you've got nurses, admin staff, visitors, donors, the general public. I'm sure there's other segments that I'm even missing in that list. And each of those unique groups has unique messaging that needs delivered to them. Now, some of the content could be relevant across multiple groups or all of the groups. Some of them might be very segmented to a particular group. Talking with someone once who was responsible for nursing communication, they talked about how difficult it is to communicate to nurses, not because nurses are themselves difficult, but because of what their job is like. They're on the move. They're dealing with doctors. They're dealing with patients. That's their primary focus. That's what we want their focus to be. Sometimes communicating to them can be a bit of a challenge. And then how do you balance that with all those other audiences that are there? So just to let everybody know, we recognize the challenges that exist within hospitals and health organizations. We feel our platform can certainly help improve or augment some of the existing communication that you have in place. So next, we're going to be kicking it off here over to Mike Lee. Again, Mike Lee is a Director of Marketing Communication for Dominican Hospital, which is part of Catholic Healthcare West. Mike has been Dominican for a long time. Mike, I won't share how many years you said. But just to let everybody know, he is an experienced communicator. He's an experienced healthcare worker. I'm sure you'll have a lot to learn from Mike and his experience of not just installing a digital signage network, but also managing the day-to-day of it. So, Mike?
Hi, thanks for joining us today, and thank you from us to MediaTile for inviting us. The one disclosure is that these webinars are surreal to me. I'm sitting in my office looking out the window and talking to I don't know who. I prefer the more organic approach. So if I seem to have the approach that I'm trying to get from the beginning to the end too quickly, I ask Chuck to slow me down and redirect me, and I also ask the people on the call to send in questions, which will help me to focus a little better.
That's okay. Just let me interrupt real quickly, Mike. That's a great point. So anybody that does have questions, please submit them through the GoToWebinar application, and then we will answer as many of those as we can at the end.
So Dominican is a community-based hospital, medium-sized, 279 beds, and by comparison, small to some of you on the call. I am in communications and marketing. Others of you may have different perspectives. I realized talking with Chuck a little earlier that since we do have a system in place, I assume that most places, most other of our sisters and brothers out there do as well. But I was in a major university medical center over the weekend, tower 12 stories high, and they still have the glassed-in bulletin boards and posters on the wall. So I realized that this digital signage, even though it's come a long way and it's becoming more adopted, that it's not universal. And actually, if we can go on to the next slide, the glassed-in bulletin board is pretty much where we started on our journey. We had one of those. We have several glass-in bulletin boards, and HR and us would put out the posters, and it was just not working. The content was boring. There was too much lag time for getting stories up, and it had to be kind of tawdry and look too much like your school used to look, rather than a professional modern organization you would hope to portray. And our goals were mostly communication. Actually, in the first slide, we saw some of the purposes for digital signage, and we actually fall into three of those. One of our first goal, our first mission, was to improve employee communication. We are a healthcare institution, though we don't really use our signage for healthcare information, such as someone might do in a medical office where they want to educate patients while they're waiting. And Chuck also alluded to the fact that healthcare is an interesting industry in which to communicate. We're much like, as you all know, a hospital is like a small town. We have housekeeping people, we have medical staff, physicians. There are clinicians of all different stripes, support personnel, 24 hours a day, and to reach all of them through one medium is impossible and futile, actually. And over the years, you fall back on the old adage, and you tell people 17 different times in 17 different ways if possible. And we went into digital signage to add one more weapon to our armatorium. Well, anyway, one more weapon to our cabinet, and to reach out to more people. Nurses, as Chuck described, are especially hard to communicate with. Many of them don't even get on email during the day, and we find digital signage to be a way that we'll get into a little bit more in their placement, a way to reach people at opportune moments when they have the time to be communicated with. See, looking at the slide here, that's pretty good. And that our philanthropic foundation was also the motivator to the size and scope of our deployment. We were undergoing a facelift in our lobby, and they wanted to replace 2 large donor recognition static signs with something more modern and more flexible, rather than having to get a new silver plaque engraved every time there was someone made a significant donation. They wanted something a little more immediate. And so we partnered with them in our lobby to put up 3 large signs, 3 65-inch signs, which we'll see in a moment. And while we were in the process of setting them up, we also wanted to utilize the technology for an emergency situation. Of course, since then, cell phones and other smartphone devices have kind of taken away some of the need, but we still have all of our signage, or several of our signs, hooked up to cable, so we could always flip a switch and go over to cable TV in the event of emergency. Can we go to the next slide, please? So we wanted a easy to deploy method. We wanted a do-it-yourself method. We have the fortune of having basically an in-house agency in our department, so we didn't want to have to rely on a third party to develop our content. We wanted our system that we chose to be easy to work with, flexible. And the next point about off the hospital network, no offense to anybody that's in IT, but sometimes working with IT can be formidable. And a big system like ours with a lockdown network, impressive firewall, adding something to the network can be it can be difficult. Let's leave it at that. And so when we found a 3G solution that didn't touch the network, that was huge to us. Having it be on the web, not having more software to deploy because we do have multiple users, not have to load the software on individual PCs, to have it out there and easily accessible was big to us as well. And the variety, we don't do much video, only because our screens are silent, even though they obviously have audio capabilities. Because ours are in patient care areas and silence is golden, we keep the sound off. So we use video sparingly, more in kind of like B-roll to just give some, I don't know, eye candy to the message. Other deployments for some of you could, utilize the audio features better. But the fact that this system can handle all the different media formats, I think, was helped us make our decision. So we do have 2 in our main lobby area. Actually, there are 3 there now. They're large 65-inch screens. One of them you see is more of a general public branding screen. And as you can see underneath, several of our screens utilize RSS feeds. We did use the weather for a while, but then we realized, this isn't the airport. People can look outside and see if it's sunny and 62 degrees. We dropped that RSS or that feature and just we go with I think it's CNN News, which that helps to modernize the slides every day, even if you don't get in there and change them. Having the feed go underneath helps to give the impression of of new material. So there are 3 in the lobby, in the main lobby, and since they were planned for ahead of time, they're set in the wall and frames, so they're very attractive and large. And the other 2 in the lobby are used for our donor philanthropic foundation to list their donors in different ways and give recognition for them, and also to announce events that they may have coming up. Now, the 3 in the lobby are obviously public-facing, external-facing. We also have 2 in high-traffic areas for staff. Actually, they're near coffee, kind of coffee kiosks, especially coffee ones where there's a lot of, people drop by during the day. One in our education building and a separate one in the physician's lounge that's not locked down, but it's by keypad only, so it has different messaging. So our hierarchy for content is, we try and make 80% of it suitable for everyone, and then some more specialized messaging that goes to staff and or physicians. But since we consider every area to be a public area, there's no content that we would be, anything but happy for our public to see. But some of the things just may not be as interesting if they're announcing an employee-specific event, something changing with HR, hour times, benefits, that kind of thing. They're all consumable by the public, but designed for specific audiences. And along with that, we have specific content management hierarchy. We have one person that oversees all of our screens and who has access to all the screens. And then we, through the features of the software, allows multiple users. There are other people who have limited access to scheduling the programming on those screens. Shall we go on?
Well, why don't you, Mike, kind of talk about some of the thoughts you guys have around digital signage in your mobile clinic. I know it hasn't deployed yet, but kind of showing how the growth of the network can take place.
Yeah, good point. The hospital is deploying a mobile medical clinic that's going to go to the underserved, since we are a not-for-profit and serve a not-for-profit hospital with a mission. We reach out to the less fortunate and the underserved in our areas. And we have a mobile wellness clinic that's soon going to visit designated areas in the county for that reason, for screenings and wellness exams. And they do want one of the screens on board, for their specific clientele. Now, how that application is going to be slightly different, I don't know, Chuck can maybe talk to if it's a hardware or software difference, but that is, we do plan to expand it to that area. Right now, we're pretty well covered with screens with 7. Is it 7 or, well, that would be 8, I think. Our 8th screen on 2 campuses. So
yeah,
for right now,
you can go ahead and keep moving. I just thought I would bring that up about demonstrating the mobility of the technology, but we can keep moving on in the webinar.
We go, thank you. So we do concentrate heavily on info, but of course, you know, the branding is always there. When people are in the hospital, they are seeing messaging, all with a very positive approach that fosters health and wellness. Actually, one of our slides, I think we'll talk about the swine flu scare from a couple years ago, when we actually had the hospital closed down, even for a medium-sized facility. We learned that we had 500 visitors a day coming through the building. So, you know, for any industry to be able to reach 500 future patients, future family members of patients was a lot bigger than we had realized. The foundation recognition and fundraising screen offers that flexibility of being able to change lists, to be able to change outreach to potential donors constantly with the screens right at the lobby where they're very visible. The staff features are, we have newsletters, in-hospital newsletters, as I'm confident a lot of you do. They, by nature, since they're still hard copy newsletters mostly, in order to reach all those people who don't access digital media otherwise on their computers, they're monthly. And so in between time, there are many stories to be told about staff accomplishments, what people do outside work, what they do, to foster and promote their work. And we find the digital signage gives us the opportunity that we can take a photo. 8 minutes later, it can be, out there. So the immediacy is, the instant gratification we're getting used to is definitely there. And the RSS feeds, the news and weather, different places I'm sure would have different uses for that, but it's an inexpensive feature, kind of an added value for the screens for people. And like I say, we used weather for a bit and found that not so useful, but the options that are available for display on the screens allows for different segmentation of the screen, and so different users may find a better use for the RSS feeds and RSS features than what you see here. After a year or so, we went for the more one item, one vision at a time thing, rather than the too much going on the screen. We found it to be distracting. And the house-wide campaigns, we can reach the immediacy is very important, and getting things out. All facilities have Joint Commission requirements to meet, like getting people vaccinated, getting the flu shots, getting their TB and Tdap taken care of. These offer that kind of immediacy and access for staff. As they're walking around, it's hard to miss this information. We went smoke-free a couple years ago, and that was a big transition, of course, and the signage still actually comes up 2 years later, or a year and a half later, just to remind visitors of the restriction, and it's helped to keep the campaign on target. When we do create all our content in-house, I think that will be, as people consider digital signage, I think that is something that needs to be reckoned with. Content can't stagnate. If it does, then of course it becomes exactly that, stagnant. So I would either prepare to spend not a huge amount of time, but to realize this is a pet that needs care and feeding. It can't be neglected. So either set aside resources internally to create your own content, or I believe that the Media Tile and other vendors probably offer content creation. if you don't have the resources for that. Next, please. The software, though I learned it in the beginning, we have another staff person that's really takes primary responsibility for our media tiles. It was a drag and drop operation, as I remember, very user friendly, lots of different formats accepted, so that anybody out there between, if you're InDesign and creates your files that way, or even you just do a PowerPoint slide for quick and dirty, you can get it up there. You can get it up there quick, and they all look pretty. Of course, the amount of attention that's put into the slide, is directly you get a direct product from the quality of the slide going in to what you see on the screen. But if it's got to get up there quick, and the message is more important than the appearance, and it's not going to be up there a long time, almost anyone can create something very usable. I think we're ready for the next. So I went through the one-to-one training. That's the 1 hour one-to-one training was I got it quickly. I haven't used it a lot. It would take me a couple minutes to get back to where I was. The weekly commitment will vary. I think it depends on how many screens you're intending to have, who your audiences are, where they are, and ultimately your goals. How fresh do you want your content to be? I would think that our staff person probably spends 2 hours a week on media tile, either taking them down, scheduling, talking about what might go up, capturing the photos and the content of what goes up, and actually creating and scheduling the slides. The roles and permissions are flexible, and I would suggest a hierarchy. Like we have one air traffic controller who oversees the whole mission and knows everything that's up there, and then other people in specific subject areas with permission to change the content on their specific slides. Their specific screens, if you have multiple screens. The web-based management is, I think is a big plus. It's there. As upgrades become available, they're made immediately, and it's all we have found it to be very seamless. Next. So the feedback is good. It is a communication tool. The actual measurement is more anecdotal, since we use it as we do a newsletter or a communication piece. And I don't know that we've ever used it for a campaign where we could track the direct ROI. People seem to get the messages, based on if it's a flu clinic, people show up, so that tells us that people are definitely getting the message. The look of it is much preferable to anything that's been there before. You basically have a beautiful definitely have a high quality screen with attractive slides that are changing. They're just aesthetically pleasing. During the H1N1 that I referenced a bit earlier, it was a fluid situation, and any of you that might be on the West Coast or in the other states who were on high alert for the swine flu, which we're very grateful didn't turn into the pandemic that was predicted. But day by day, we went from restricting visitors to adding age restrictions to screening everyone who came in the hospital. So having the availability of screens to both educate and alert were very useful to us during those times. Fortunately, things calmed down, and we've taken down all these signs by now, but they are a reminder that of the immediacy that digital signage does provide. And you know, all of those of us who are trying to run green organizations, the cutback on the bulletin boards and the posters and the photos that had to be printed to be put up, that's all eliminated. Next, please. Our lessons learned, if we haven't covered any of these are good, all good things to think about. The relevance to specific locations, I would commend you to think about who your audience is, who might see it. I think to fantasize that you, besides maybe a physician's lounge, to think that any screen that you deploy won't be seen by the public, I think is not the best approach. So make everything consumable, positive, upbeat, and as flattering to your organization as you possibly can. I think that's pretty much what I have to offer at this moment. But Chuck, if you have anything more, or we can take any questions.
Yeah, I think we'll just wrap up a few of the final slides here. Thanks again, Mike, for sharing your story. And there's a link there at the bottom for anybody that was interested in learning more about basically a lot of the case study that Mike shared. You can get it there on our mediatile.com/solutions/healthcare. We'll just run through some of these next slides and then answer any questions that were submitted. So again, just the benefits of MediaTile: simple, secure, and flexible. You see the variety of locations our technology has been deployed, as well as some of the benefits as it relates to security, networking. As Mike mentioned, sometimes navigating the IT world for communicators and marketers can be a bit challenging, and we certainly try to help and involve ourselves in some of those discussions when possible for anybody who encounters any difficulties. So cloud-based digital signage, talked about our hardware being cloud connected over the cell networks, software cloud controlled through MediaCast, our web-based CMS, and then our cloud created content through media services. Anybody that wants to see the software can go to mediatile.com/software/demo and get a look at some of that drag and drop interface and some of the other features that Mike had described. So we are the world leader in cloud-based signage powered by MediaCast, all-in-one players and digital signage in a box solutions that Mike Lee talked about. Go on to the next one, please. Anyway, more information can be found at mediatile.com. You can also read the blog that I help author at blog.mediatile.com, and other opportunities to connect with us, other people who are interested in social media. We try to be very active and answer questions on there as well. So I think, Melissa Oakes, has there been any questions submitted that we can answer?
The one that we have so far is someone asking for a price range for the Dominican project.
Okay, well, I'll tell you what, we will, for that person that asked that question, we will get back with you directly because every project is a little bit different based on installation, based on screens, players, networking, all that factors into a cost. So the person who answered that will be back in touch directly.
Okay. The next question is, why did Dominican decide to use cellular versus LAN network?
Hey, Mike, do you want to address that quickly?
Hopefully I understand LAN network as opposed to cellular, but our hospital-wide network that all the computers are attached to is very protected. Getting anything added to that is an IT process that is cumbersome, and not everything. There is not a high degree of desire to add things from the outside onto the network. So something that operated outside and extraneous to that network was a big plus to us.
Perfect.
Next question is, if you have multiple facilities, can content be different for each location, or does it need to be the same for all?
Yeah, I can answer that one, Mike. So yeah, for anybody that's looking to deploy across outside of just one facility or multiple facilities, you can segment your network as much as possible. So let's say if you had 5 or 6 different hospitals. You could have some messaging that would sit across all of those hospitals because it's relevant based on that network, down to some messaging that maybe is very specific to a hospital, down to messaging that's specific to a floor where that screen is, all the way to just one particular screen. So your messaging can be similar across a network based on its relevance to that audience, but you then have the ability to segment that network down to deliver that right information just to the right people.
Next question, can individual signs display different content at various times?
Yeah, so part of the MediaCast solution is a very robust scheduling platform. So a lot of our customers, maybe they rotate content throughout the day. A key part of that scheduling is displays can be turned on and off if necessary. But you can then, the industry term is called day party, where you can say, maybe based on the audiences, maybe your visitors, maybe your patients, and to be one demographic in the morning hours versus the evening hours, you can schedule your content to appear at those various times. So again, that content is being seen by the most relevant audience.
Okay, next question, did you run into dead spots? And if so, how did you account for that?
We've never had any problem with that.
Yeah, I will say that's getting to be less and less of an issue thanks to the work being done by the various cell carriers in strengthening their networks. That pretty much from what I've experienced in working through many customers, you almost have to be in the a basement of a bunker somewhere to sometimes not get that needed cell signal. So for those that are interested in cell, obviously tests can be done to verify the quality of signals in areas, but again, that problem is becoming less and less.
Okay. Another question along the same lines, specifically using wireless connectivity, were there any in-building coverage challenges around lead walls, radiology labs, et cetera? So I think we just answered that.
Yeah, by the way, all great questions. Far and away the most questions we've had asked in any of our webinars, so this is great.
Yeah, and just there are a couple questions about us sharing this deck, and this recording will be available on our website within the next couple days. So you can check back on our website, mediatile.com, to view this.
Yep, and we'll also do a follow-up blog post as well, so for anybody that wants to kind of do a recap and then link back to the webinar, we'll provide that on there as well.
Yep, and I think that's all the questions we have for now.
Okay, well, again, thanks everybody for your participation and interest. Thank you, Mike Lee, for taking the time out. We always appreciate it when customers are willing to come on board with us and help us provide these educational webinars. And anybody that has any direct questions, or if you think of something later you wanted to ask either myself or Mike about either his installation or just MediaTile in general, you can always email info@mediatile.com and we will get back in touch with you. So thanks everybody and have a great afternoon.
Thank you.